this is my grandfather, Saba Moshe. My grandfather Moshe. That's me on the right here. Young, beautiful, and with lots of hair. Grandfather Moshe was born in Romania, in a small town. And I remember his stories. He had very vivid and funny stories about the life, the turn of the century in a small Jewish town, with all the Yiddishkeit and all the funny stories. And he had an excellent memory and really a vital part in our family. Saba Moshe suffered from Alzheimer at the end of his life. And it was very, very difficult for him, and it was also very, very difficult for us, the family. Because the Alzheimer's disease is not a problem just for the patient, it's also a big problem for the family. The numbers are staggering. It's estimated that about 5 million Americans are suffering from Alzheimer. Every year, 500,000 people die with Alzheimer, and it's the 6th leading cause of death in the United States. But the most staggering number is the unpaid hours of the caregivers taking care of their dear ones that suffer from Alzheimer, $220 billion annually. Alzheimer is a very elusive disease. There are no drugs to treat Alzheimer at this time. And the question is why? After so many years of research and many big failures, what is the reason that there is no cure for Alzheimer? Today there is an understanding among the scientific community that probably we diagnose Alzheimer way too late, when there are cognitive impairments and there are memory complaints. And this is probably way too late. It has been discovered that a contributing factor to the development of Alzheimer is the formation of plaques in our brain. Plaques that are formed from a protein called beta amyloid. And we can now understand and we know that 15, 20 years before any cognitive impairments, those plaques start to accumulate in our brain. But until just a few years ago, the way we would diagnose Alzheimer was just by memory testing and cognitive impairments testing. So how can we distinguish, or how can we identify processes that are occurring in our brain before those signs? And that's exactly what NeuroQuest is doing. Our technology is based on Professor Michal Schwartz's discovery and research. She's a very renowned neuroscientist. Her research articles are being published all the time in Science and Nature magazine and are described as a game changer in the field. Actually, Jacoba and I just were visiting the NIA a few days ago, and she gave her a presentation, and they were really, really impressed about her research and about the shift of paradigm with respect to the way we think how to develop drugs for Alzheimer and how to diagnose. She describes the relationship between the peripheral immune system and inflammation in the brain. And according to her theory and research, there is a unique signature in our peripheral blood system that will correlate to the development of such inflammation in our brain. And we've researched exactly just that. So we are developing a simple blood test in terms of procedure that will enable us to correlate and identify those people that are healthy, seemingly healthy, but are developing such inflammation many years before any cognitive impairments. We're very, very lucky to be invited to participate in the leading diagnostic research in Australia, the ABLE study. This is a big cohort of 1,500 subjects being conducted for the last 6 years. And we have already very impressive and encouraging clinical data. We analyzed the data over 70 subjects, and we have very good specificity and sensitivity, which are the key parameters when we're doing the diagnostic testing and comparison. So we have very, very good encouraging results, and we are continuing to do the clinical trials in Australia and aim on commencing clinical trials here in America. Now, they told me I have only 5 minutes, but here in Charleston, I need to steal another 1 minute and speak about the relationship of NeuroQuest to Charleston. It has been mentioned that NeuroQuest already has some presence here and has partners. SCLA are investors and partners. The Intertech Group, Jonathan Zucker, Jacobo and Roper San Francis, and also Sila Genomics, which are not present here right now. But what I want to say is that I have a feeling of being here within the family. Speak my mind. I'm sorry, Morris, but you're also a very important part of ours. It's been like being in a family here. You guys give us a warm welcome and an infrastructure being vis-a-vis investment, facilities, legal advice, investors, all of them, you come together and you harness your powers and contacts in order to give us very soft landing here in the United States. And I hope really to amplify this presence here in South Carolina and really get into the activity here in Charleston. So really, thank you very much for all your support. And for you guys, that's a very good place to be because they will take care of you as a group, not just as individuals. So please use the opportunity. Thank you very much.
Also, just for what it's worth, Todd, Sila was one of the 9 exits we've had since 2006. So we had about, out of the box, because it was cash in, stock out, we had about just under 6x appreciation. For what it's worth.
It's worth 6x.
That's right.
We are now raising through another round, and already the current investors have indicated their intention to participate in this round, so that also is an indication of their commitment. I've just touched the iceberg, the tip of the iceberg regarding the company. I didn't speak about the IP, the science, the team, the work plan, etc., and commercialization plan. There's a lot to discuss, and if you'd like to hear more about the company, maybe be part of it, you're most welcome and invited to come and talk with me. My name is Dan Twitu, and I'm the CEO of NeuroQuest. Thank you very much.